Just a quick introduction. So I'm Yuzhe. I'm a faculty at UCLA with appointments in departments of computational medicine and computer science. So this talk, I'll briefly talk about a few directions happening in our lab, basically working with everyday sensory data and how we can leverage that sources for healthcare. So just to motivate things, let us review several gaps in today's healthcare and medicine. So first, I want to highlight that, as everyone here probably know, like clinical visits scheduled by ourselves or by people are pretty occasional, and the intervals between two visits are often several months, if not years. And that's a problem because it means diagnosis can be delayed by a lot. And a lot of times, we don't catch diseases until they reach advanced stages. And this is even exacerbated by the huge dark spaces in healthcare that are never observed by any clinicians. So we probably can name this as a time gap, okay? And in addition, we know because of the shortage of clinicians, hospitals' care was only limited to a small group of patients, and not everyone can easily access healthcare resources. And this will cause a location gap. And on the other hand, we have a huge amount of personal devices and sensors around us. So these sensors, such as your smartwatches, your phones, they will passively collect our health metrics, such as your gait, your heart rate, your breathing, your sleep, etc. And what if we can turn these everyday devices into intelligent health sensors that actually tell you your health metrics and give actionable insights? So imagine with these AI-powered everyday devices, probably in your home, okay? And what if you can get your physiological vital signs, such as breathing, heartbeats, or even sleep, but just using those ambient sensors in the environment without touching your body? And what if these smart devices can even do further complex disease diagnosis, and some of them can even before the actual clinical diagnosis? And perhaps they can also read your disease progression, help the prognosis, and reveal the continuous and very frequent changes. And that will also give us implications on how you can adjust your medications. So this is what I'm going to talk about today. So in this talk, I'll be briefly discussing two directions that our lab is working on towards this vision. And these two directions are kind of orthogonal. So the first one, I'll start with how we can use our daily sensor data to build AI-based digital biomarker, and this time for a specific disease, which is Parkinson's disease. And then on the second part, we'll move to how we can build the so-called general purpose foundation models for this wearable or sensor data specifically. And those can enable many capabilities, such as detect many diseases, like health-related activities, and generate insights even in our human language. Right, so let's dive in. And this project is a collaboration between multiple institutions. And the aim is we want to build an early diagnosis biomarker for Parkinson's disease. So we all know Michael J. Fox, right? And he's one of the most well-known TV show and movie star with his famous Back to the Future series. So here is an interview video by Michael. And from this video, we can clearly see his irregular body movement and his hand tremors, right? And in fact, this is because Michael was diagnosed with Parkinson's disease, and PD in short. So what is PD? So PD is the fastest growing neurological disease in the world. And over 1 million people in the States and 10 million people worldwide are living with PD as of 2020. and this results in an economic burden of $52 billion per year. However, a key difficulty in Parkinson's is that we cannot diagnose it in time. So in clinics, the disease is typically diagnosed based on motor symptoms like tremor and rigidity. However, these motor symptoms often manifest many years after the disease onset. And by the time when the clinical diagnosis is made, the disease has already been progressed for decades and causing non-reversible changes in our brain. So the challenge isn't just to identify Parkinson's, like this picture on the right. So the real goal is we should have the foresight to detect the disease early on, even before anyone has any clinical signs. So researchers have thought about how to get this foresight for decades. And people have studied CSF, neuroimaging tests, and even biochemical evaluation as potential early detection methods. And while these markers have pretty good diagnostic accuracies on their own cohorts, they have some drawbacks. So they're pretty invasive, they're expensive, and they require access to specialized medical centers. And as a result, they could hardly diagnose disease in the early stage where we don't have any symptoms. So we ask ourselves, could we find biomarkers that can be easily collected repeatedly every day in your own environments and also that can be as accurate as these clinical measures so that it will inform some insights or even early diagnosis of the disease. So in this work, we developed an AI system that analyzes our nocturnal breathing signals, basically your breathing during sleep, to detect Parkinson's disease. And that shows evidence that can detect the disease multiple years before the traditional clinical methods. So here's how our system works. We basically capture the breathing data either from a breathing belt worn by the subject on their abdomen or chest, or we can build a wireless sensor that can transmit wireless signals without attach any sensors onto your body. So with either method, we're able to obtain this full night of breathing data in high resolution. And after capturing this nocturnal breathing, we design an AI model to extract disease information directly from this data. So our model has two outputs, whether the person has PD or not, and also assess the severity of their disease in accordance with some gold standard clinical measures. So how do we do it? And recall that we want a model that takes in the full night breathing data and output whether this person has PD or not. So let's first look at this binary classification task. So to construct this model, people may think about, okay, why not begin with some classic methods? Let's say a support vector machine. So here are the results, okay? On our test set, the SVM achieves an AUC, which is a measure of accuracy of just around 0.5. And this is essentially random guess. So clearly we need to go deeper. And what if we turn to these state-of-the-art methods in deep learning, like transformers? And unfortunately, even with these advanced methods, they perform just marginally better than random guess. So what's the blocker here? So there's actually a few key challenges we identified during this process, and I'm going to just mention one main challenge here. And in the nocturnal breathing data, this is actually a pretty high dimensional data with tens of hours and very high sampling rate, like 10 Hertz. And this output of this network is extremely sparse. So we're essentially trying to infer one bit of information from a very high dimensional and dense input. So this sparse supervision poses a very classic problem in machine learning community. It's called overfitting. Okay, so the model will easily overfit to some spurious features in the very high-dimensional and dense input, while learning nothing related to the actual disease information. So the question is how we can regularize the model training so that it can effectively capture the information about the disease. So our solution is inspired by the link between Parkinson's and our brain activity, as PD is a neurodegenerative disease. And in fact, when we go to sleep, our brain activity would fluctuate throughout the night, which can be quantified by the brain EEG signals. So based on different frequencies of our brain waves, we can divide EEG activity into 4 different frequency bands. And different EEG activities are associated with different physiological functions of our brain, which naturally provide useful information for Parkinson's. And you might wonder, because our input is breathing data, and how are we going to connect breathing with EEG? Or can we actually predict EEG from breathing? So we show that by just using your nocturnal breathing signals, we can reconstruct the EEG throughout the night with pretty high accuracy. And such a prediction task would bring natural dense supervision for our method. And specifically, instead of directly predicting the disease, very straightforwardly, we will add another prediction branch to predict this brain EEG activity across the whole night. And this essentially translates to a multitask learning framework. And this EEG prediction will serve as an auxiliary task to help regularize the model training. And indeed, we see that by integrating this auxiliary task, we see a very significant improvement in the model performance from Chen's level to an impressive 85% accuracy. So to further validate these results, we collaborate with many institutions across the states, and in total, we collected we have over 7,000 individuals, and within those population, we have over 700 PD patients. So we basically tested our model on different sites, and for each site, we will just train the model on data that doesn't overlap with the sites with this specific site, and basically leave site out evaluation. And also tested the performance across different modalities where we collect the breathing data. And of all the sites we tested, the performance are equally good, and they're very robust to different measurement settings. So I think the most interesting thing about this project is can we actually do some early diagnosis or early detection of the symptoms. Okay, so in our data set, we find a very interesting cohort of patients. They basically have 2 tests in the longitudinal study. And this group of patients, they were diagnosed with Parkinson's 6 years later in the clinic, but they were not diagnosed 6 years before clinically. And we do have measurements for these 2 visits. So we directly test our models on this early cross data, which we can identify them as prodromal PD patients. So first, we collect age and gender and other comorbidity matched control subjects to those prodromal groups. And we show that the model is able to identify them as normal individuals. And we further test on this prodromal group, we show that the model is actually able to identify most of them as Parkinson's, and that is statistically higher than the control group. So I would say one limitation of this test is as you can read from this number of participants here, this prodromal group is inherently very small. So I would say like this would be an early evidence, but actually demonstrate the value of this everyday sensing. And using this everyday sensory data, we might reveal evidence that on the other hand is not available. So although I didn't cover this part, our model is also able to detect the severity of Parkinson's. And as I show in this graph, the x-axis is the MDS-UPDRS, which is a gold standard clinical measure of disease severity, and the y-axis is the model prediction. So we see this, the correlation is pretty high with statistical significance. And the interesting thing with this capability is that once we can evaluate severity by monitoring breathing of patients every day at home, we can even track the disease progression over time in a very fine-grained and continuous manner. So let's see one patient we monitored for over 1 year using our system. And here, basically traditional clinical measures of PD severity highlighted by these yellow bars, they're very infrequent and can exhibit pretty high variance. For example, we can read from the score at month 6 that are significantly lower than the baseline score. But we know this is impossible, given Parkinson's is non-reversible right now. And this is likely due to the substantial variance when you visit the clinic, and different clinicians will give you different scores. And let's look at the predictions from our AI model. So as you can see, we average the predictions over a certain period to make it more robust. So basically, you can tell from the median score of the prediction that it can capture the gradual changes of the patient state, and it offers more robust and frequent measurements. So this could let us understand the disease progression on a much more personalized level. All right, so that's the first part on this early diagnosis of a specific disease, Parkinson's disease, using our sensory data. And we then take a step further to see, okay, once we collect this humongous amount of sensor data, can we build this so-called general purpose model so that we can easily adapt to downstream tasks where data are not that abundant? So I will introduce a series of works we recently built with collaborations together with Google and University of Washington and etc. on building this multi-model foundation models for wearable sensor data and connect this wearable model to our human language. So it has been more and more ubiquitous that our smartwatches and phones can continuously capture our vitals accurately. And this will include a wide range of measurements such as heart rate, respiration, blood pressure, etc. So this is really exciting, as more than 7 billion people on Earth hold a smartphone. And if we can deploy such capabilities at scale, it will be accessible and enable in-home or contactless screening or triage. So the question or the issue is, it is still far from being scalable, as the labels of these vitals or the labels of certain disease or outcomes are really limited. So to illustrate this, we want to start with like why we want to build a foundation model. So typically, we can collect unlabeled data or in the wild data from a large population, and that will be pretty high resolution and diverse across users. On the other hand, if we want to do a specific trial or cohort study, we will collect a limited number of participants and they have similar conditions or outcomes we care about. But this study dataset or study cohorts will be intrinsically small, and they're very sparse or population constrained. And in reality, they're usually much sparse, much smaller compared to the actual unlabeled data in the wild. So as the first effort, one of our recent work builds a so-called large sensor model. And that is using the common smartwatches and the sensors on the smartwatches. And it will cover around 30 different brands or hardware platforms. So we basically extracted around 20 channels, such as accelerometer, temperature, PPG, and we use a very straightforward pre-training method. It's called like masked autoencoder. Basically, we just masked some of the input and trying to reconstruct that input. So such a foundation model goes beyond this traditional classification or regression capabilities and also capable of generative or discriminant tasks with little or even like no fine-tuning. So I want to quickly comment on the scale of the data. So by the published date of this study, it was the largest experiments on wearable data. And compared to other studies conducted by Apple or academic institutions, it covers already around, I guess, more than 40 million hours of wearable sensor data. So with this large scale of data collected, the first thing we want to validate is, okay, do we observe scaling loss in this wearable data? So this is interesting as we always observe this GPT scaling loss from OpenAI that if you just increase your compute or increase the number of data samples, the model capabilities will increase. And you don't need specific tricks to train your model. So we also perform similar analysis on our sensor data and observe similar trends on the scaling patterns. I would say like across dataset size, across the model compute, and also across the model parameters, we see pretty good scaling patterns. And that indicate we just need to collect more data, and using a very straightforward pre-training method, we'll get pretty powerful models in this space. So as I said, like for pre-training, we just need to collect unlabeled data in the wild. And the powerful thing about this model is we can adapt to very small studies as downstream tasks. And once we collect data for specific cohorts, we're able to fine-tune this model a little bit to adapt to different downstream tasks. And that can perform a lot of disease prediction or even like daily human activity recognition. So as a first step, we show that this model is able to predict human activity very accurately. So we show a subset of these activities we evaluated. And in total, we have around more than 60 different activities in daily life. And this model can predict pretty accurately across different activities. And what's interesting about this model is it can also impute missing data, and is pretty robust to missingness. So what I show here is you can see the gray area, which is originally masked or intentionally masked as missing in the input data, and we try to ask the model to impute these wearable sensors. And as a result, you can see the model reconstruction is pretty good and aligned with this ground truth data. And once we have this foundation model for wearable data, we ask ourselves, because the wearable data is not that inherently interpretable by human, and can we actually let these wearables speak for themselves in natural language? And I'll explain what I mean here. So we have wearable data from this different heart rate, temperature, and we can get this one sample of this wearable data across the whole day. And what if it can simultaneously generate the paired text descriptions, such as your heart rate bumped at minute 80, and you perform an activity during this time, and your overall health is blah, blah, blah. So, so along this line of research, we propose a new type of foundation model called sensor language model, and SensorLM in short. So for this model, the key challenges is how we can describe the sensor data, which like unlike the vision or other communities, they have paired data exist in the wild, and here we don't. So what we propose is to describe the sensor data in a hierarchical way. So we first describe this, these statistics. For example, for different channels, they might have different statistics of their mean, their standard deviation, their maximum or minimum. And further, we describe the structural information about this data, such as the trend, the peaks, or even some abnormalities. And finally, we also describe some semantic information where this can incorporate some higher level labels like activity or health outcomes. And by combining these two modalities, basically the sensor modality and the language modality, it results in this so-called SensorLM model, which is able to do many interpretation or alignment between these two distinct modalities. So I will showcase a few capabilities of this model. So first, it is able to do zero-shot prediction. So by zero-shot, we mean during deployment, you never need to fine-tune the model again. You can just input your query as text and ask the model to make predictions based on both your query and the wearable data. So we compare our model with off-the-shelf large language models, as they are also zero-shot predictors. So we compare with Gemma, which is an open-sourced 27 billion parameters model, and also the Gemini 2.5 Flash. So across all these different tasks, including activity recognition or environment context recognition or whatsoever, we see this substantial gap. Like our model can predict, our model has like a better prediction accuracy compared to other models, and all these like existing LLM baselines are nearly random. And another ability achieved by this model is you can align these two modalities so that you can actually retrieve the sensor data based on your task description or vice versa. For example, here we have your sensor data that records your heart rate, your accelerometer data, and even the temperature. And there are a few events happening. For example, during minutes 0 to 300, you're asleep and you perform a treadmill and strength training afterwards. So our model is able to retrieve the accurate description from a very large pool of captions, around like tens of thousands of captions. And I would say the retrieval similarity or the score is actually aligned with how much context in the caption is aligned with your wearable data. And more interestingly, this model is also able to do zero-shot generation based on your sensor data. i.e., you input your sensor data, it will generate a description automatically. For example, here I show one example where like you perform outdoor biking around like 2 p.m. and then you go to sleep around 11 p.m. So this will be a ground truth, so-called ground truth, if we were to describe this activity. And we also ask Gemini to generate this description, and unfortunately, it does not generate, does not capture these activities, or even the localization is not accurate. And for our model, So first of all, we are able to capture this exact event. And more interestingly, if you look at the numbers, the detection or this like the localization capability is also intriguing, that it can pretty precise localize when the event is happening. And we're further extending this model to more diverse or downstream cohorts that incorporate metabolic health, sleep health, and other health-related tasks. So I'm almost at time, so I just want to give a quick, a brief overview of the future work I see in this space. So I really like this, this graph. And I've been talking about like physiology or sensor data specifically in this talk, but you can see like there are actually like many medical modalities outside, like genetics, radiology, etc. And each of them will give you very important information. So just by incorporating all this information together, we probably can precisely recover the holistic picture of human health. And this is not, this is not only research to wearables, and beyond this, we can have sleep, EHR, genomics, pathology, and radiology. And ultimately, what I believe for medical superintelligence is we will have a health world model that can interact with all this data and give you personalized recommendation and predictions. Right? So I'd like to thank all my exceptional collaborators and excited to build more collaborations here. And okay, thank you very much for listening.